This is my pin site care video. Before we get started, there's a few things that we need to discuss, including the definition and purpose of an external fixator device. The device is a splint or a cast with metal plates, screws, pins, wires, or rods, which are used to keep a fractured bone stabilized and in alignment. The importance of pin site care includes reducing the risk of infection because the pins are going through your skin into your bones. Also is because we want to prevent the skin from attaching to the pins or the wires. Supplies needed for pin site care include gloves, cotton-tipped applicators, a cleaning solution, which today we have normal saline mixed with chlorhexidine, and a trash can. Frequency of pin site care should be daily or what the surgeon has requested for the patient. Care while showering for your pin site. We want to make sure that the water and soap runs downward from the pin site, and we don't want to scrub the area, and we want to make sure that it is dry thoroughly. It's also recommended that pin site care is done while showering because while the gauze is soaked, it makes it easier to remove that bandage and also makes it less painful to clean the pin site area. When to notify the provider is anytime the nurse suspects infection, which could include signs of swelling, redness, warmth, tenderness around the site, any odor, or drainage, which could be like a yellow discharge, for example. Also the rationale with why our cleaning solution. Some sites say that sterile water is recommended, some say normal saline, some say a mixture of normal saline with chlorhexidine. It's really what the surgeon has written in the orders for today. We have that mixture. So before we get started, we're gonna always wash our hands and don proper PPE, which we have already. And the first thing that we're gonna do is dip our clean cotton-tipped applicator into our solution. And we're gonna clean one pin site at a time using a new cotton-tipped applicator for each pin. We're gonna go in a circular motion, cleaning from inward to outward, making sure that we remove any of that crust which may have formed. And we're going to dispose of that. Again, we're gonna soak our cotton-tipped applicator, starting at the pin site, moving in a circular direction, moving from inside to outside of the skin. After all the drainage has been removed, we're going to take a dry cotton-tipped applicator and dry our area, making sure that we remove, again, all that crust and make sure it's clean. Dispose, and one more. Moving from the inside to the outside. And that's it, we're finished.